abdominal pain. Knock, knock. Hello, Miss Johnson. My name is Dr. Jennifer Reynolds. I am the physician in the office today. It is nice to meet you. Are you comfortable in this room? I am here to do a physical exam and ask you some questions. Is that okay? May I put this drape on your lap? Thank you. Do you mind if I sit down and write while we talk? Thank you. Miss Johnson, can you please tell me, how can I help you today? I am very sorry to hear that. I will do everything I can to help you. Can you please explain to me what you are experiencing? Was this belly pain sudden? Did this happen over a period of time? I am very sorry to hear that. Miss Johnson, can you please point to exactly where you're experiencing the pain? On a scale from 1 to 10, 10 being the worst, how would you rate your pain? Can you tell me what type of pain it is? When did the pain start? When you get the pain, how long does it last? In the last month since the pain started, has it been getting worse? How often do you get the pain? Is there any particular time of the day that you get the pain? Do you get this pain more when you have your period? Do you get this pain more when you eat certain foods? Is the pain constant? Or does the pain come and go? Does the pain move anywhere? Miss Johnson, can you tell me, is there anything in particular that makes the pain worse? Is there anything in particular that takes the pain away? Thank you for answering these questions for me. I would like to ask you a few more questions, if that's okay. Thank you. Are you experiencing any bloating? Have you had any changes in your weight? Have you had any changes in your appetite? Are you on a specific diet? Are you experiencing any nausea? Have you vomited? Do you have diarrhea? Have you been experiencing any constipation? Are you on a high-fiber diet? Do you drink a lot of fluids? Do you have any difficulty with cold temperatures? Do you have any difficulty with hot temperatures? Have you noticed any changes in your skin? Have you noticed any changes with your hair? Have you had any changes with your bowel movements? Is the color of your stool changed? Are you having any difficulty with urination? Do you have any burning with urination? Do you have any pain in your back? Have you noticed any discoloration in your hands? Have you had a fever? Did you get the chills? Have you taken any antibiotics recently? Have you traveled out of the country recently? Have you gone camping? Have you ever had abdominal surgery? Do you have any history of diabetes? Do you have any history of pancreatitis? Thank you, Ms. Johnson. May I ask you some questions about your health in general? Have you had any recent infections? Do you have any difficulty breathing? Have you had a cough? Have you had any chest pain? Ms. Johnson, may I ask you some questions about your gynecological history? When was your last menstrual period? Are your periods normal? When was your last pap smear? Have you ever had an abnormal pap smear? Do you have any children? How many times have you been pregnant? Have you ever had a sexually transmitted disease? Have you ever been in the hospital? Have you had any recent trauma? Ms. Johnson, may I ask you some questions about your past medical history? Do you have any major medical conditions? Have you ever had this type of pain before? Ms. Johnson, may I ask you some questions about your family history? Are your parents alive and well? Does anyone in your family have similar complaints? Have you ever had surgery? Ms. Johnson, may I ask you some personal questions? I can assure you everything we discuss is in complete confidence. Thank you. Are you sexually active? Do you use protection? Do you smoke? Do you drink alcohol? Do you use recreational drugs? Whom do you live with? What do you do for work? Are you married? Ms. Johnson, based on the information you've given me, I am very sorry to hear about what you are experiencing. You have told me that you've had a bellyache for 1 month now. You have constipation and diarrhea that have gotten worse over the last month. That you have pain right in the right side of your belly. The pain doesn't move anywhere. It's an 8 out of 10 in intensity. It's alleviated with Pepto-Bismol and Malax. Food makes the pain worse. You have not been nauseous, but you have vomited yellow vomit twice that tasted sour, and you're not having any problems with your urination. Is this information correct? Thank you. I would like to do a physical exam now. Excuse me while I